patients that come in that have had leg ulcers for 2 or 3 years. And for that whole 2 or 3 year period, they have either been wrapped up with a dressing, which produces a great deal of drainage, itching, flaky, scaly skin, very unattractive appearing leg if you're constantly in a bandage all the time. It's like you ever been in a cast. When you take the cast off, that's what it looks like. And a lot of fluid buildup. Fluid buildup causes a perfect environment for bacteria on the surface. They have intermittent infections. They have odor. Lots of times it's enough odor that you can smell it from the outside quite a bit, and the patients will have not much of a social life. Can't go to a restaurant, you can't hang out with a family. And when they're able to treat their edema without the dressings and get away from that, and then either allow for continued healing, which in a number of cases we've been able to stop the dressings and use pumps and the patients have gotten better, or prevent recurrence of the ulcers, because 70% of all wounds, particularly venous leg ulcers, return within a year or two after they've been healed. And preventing recurrence so that you don't have to go through the whole process again, healing up quicker, being allowed to bathe and put advanced bandages on. There are so many bandages or dressings out today that are what they call advanced therapies for wounds that don't heal effectively within 4 weeks, that you can't use if you're under a wrap. There are a lot of dressings which are made to be placed on every 2 or 3 days. And if you're in a bandage that lasts for a week between visits, and it's hard for patients to get in more than once a week. If you have a dressing that's on there a long time, you can't put on fancy grafts as frequently as you'd like. Maybe can't stimulate the wound with healing and treatments and other things. So this allows patients to get it out, bathe, apply these advanced dressings to the wound, and still control their edema in such a way that they have a little bit of a normal life.
But as we continued on through the years, we found that the compression pumps, we were getting the most successful results immediately. Nobody else called us and said, by the way, I love my walker. I walk to the store with it. But we were getting calls, even when we were only doing 5 orders a week of pumps, we were getting calls and letters back from our patients saying how wonderful this is, how they got the quality of their life back. Their legs have decreased in girth and they can walk around the house again. Unsolicited. We get 20 or 30 of those every week now, and each one of those letters we keep in a folder, and I have to confess that there are times where I will go back and take a look at those and read those, and all of a sudden it excites me again about what we do and who we're helping. And they don't know us. You know, they're a folder in the office, but they're a person that we've now helped, and they've responded by sending back how they're doing in their life. That particular product became the niche.
And quite often the scenario is the pump arrived, we had to take it out of the box, read the instructions, set it up. We really never knew exactly what we were doing. There was no one to call, there was no follow-up, and most of the time that equipment falls by the wayside, it's not used, and it's a waste of not only their time but money. That does not exist with Medical Solutions. They'll make sure the equipment has arrived, they'll send someone out to unpack it, package it, they'll in-service the patient, and they've always been available to me no matter how long the patient has had the pump, to go out to look at the pump, make sure it's functioning, or even work with me to upgrade the pump at some point in time.